Coronavirus infections are increasing rapidly across India, but there's at least one notable exception. Kerala, the southern state, had some of India's first confirmed cases and at one point had the most infections in the country. But today it's being hailed a success. The curve has flattened, the death toll is low and the recovery rate is high. But the danger isn't over just yet. As thousands of citizens return home, the state risks a second wave. Will they overcome it like they did the first? Well, our next guest has been called the coronavirus slayer for her response to the outbreak. KK Shailaja is Kerala's health minister and she joins us now from Thiruvananthapuram. Good to have you on the program. Ma'am, there's a new uptick. Are you worried that all of your hard work might be squandered?
Yes, we are enthusiastic now also because our preparation and our preparedness is like that. But as you said, the second wave occurred here because of the factor that most of the peoples are returning from abroad and also from other states of my country where the virus is dense, and we are facing that phase also. Actually, we divided the spread of coronavirus in three phases. First part, it came from Wuhan. More than 72 people returned from Wuhan at that time in January. And January 30th, we got the first positive cases, the first corona positive person in India, we can say. And after that, February 2nd and 3rd, we got 2 cases also. And all these 3 infected patients cured and left the hospital. And we yielded a very good result out of that because we started our preparedness earlier. When we heard that the virus is spreading in Wuhan, and when WHO declared, WHO had a statement in January, I think it is in January 18, that potential virus is there in Wuhan. At that time, when we happened to hear that virus, we started the preparedness here because I'm sure that someone will return from Wuhan to Kerala because in Wuhan University, so many students are studying there. Keralites are studying there. Definitely, they will return the month of January, February, or March from Wuhan.
Right.
And we started all the preparedness here, and we screened them in the airport itself. We started our control room in state level. We started. We formed 18 expert groups to tackle the problem. And we got these 3 cases, and we yielded a very good result out of that. No death happened. And the second stage, again, the virus came from other countries. The second part, it came from Italy, but we didn't stop our surveillance in the airport and our activities. From the airport itself, we got some Italy-based cases. One family didn't reveal their identity in the airport, and they went back to their village. And from them, some secondary infection occurred there. Some contact cases we got, and we traced that contact all of a sudden. We have a very good contact tracing mechanism, very expert team for contact tracing here, and we traced all the contacts. And at that second stage, not only from Italy, but from UK, France, Spain, and USA, from every part of the world, people came to Kerala by flight and by flight.
Right.
And that time, totally, we got 512 cases. With the Wuhan plus the Wuhan cases, we got 512 cases. All the 512 discharged from the hospital. Out of that, 3 deaths happened. That 3 that we cannot avoid because such is the comorbidity in them, and they died. It is a pity. But we saved old age peoples in that stage. 93-year-old man and 88-year-old lady, they cured and discharged from the hospital. They got coronavirus and they discharged from the hospital. So many veterans, more than 70 years. From the foreigners also, there are people above 70 years from the UK-based people, tourists, and we cured all of them and discharged from the hospital. They expressed thanks to us, and we are also very happy. We are also very happy.
A lot of people, sorry to interrupt you, a lot of people are trying to figure out why Kerala is so special, why Kerala has done so well. If you'll allow me very briefly, I'm going to give you an anecdote. 11 years ago when I was in India covering the elections, Some people from Kerala were telling me, well, you see, with us, we're highly educated. We have a great emphasis on education in Kerala. That's why we don't elect Bollywood stars and we don't elect cricketers. We focus on education here. Would you say that the same applies to why you've been relatively successful when it comes to COVID-19? Because the state has emphasized education for every citizen above all else?
Yes, definitely. It's a different social status here. Ours is not a financially fit state, and we have no more revenue income other than the government shares. But our social status is very good and very high. And how we achieved that social status here? The Human Development Index is high in Kerala. I think it is because of our planning from 1957 onwards. As you all know, 1956 onwards, the language-based state, linguistic states formed in India, independent India, after independency, and in Kerala, a new government elected democratically in 1957, and it is a left-oriented government, and M. Shankaran Namboodiripad was the chief minister. That government had some reforms and some acts they passed. The special thing was to allow the individual to own land. The anti-eviction law. At first, we have an ordinance, and then we passed an act in our legislature, and also we started land reformment. Due to that land reformment act, most of the Keralites have some lands of their own, 5 cents or 10 cents of like that, and they stand still there.
Ma'am?
Because of that,
Ma'am,
the Islam for...
Yes. If you don't mind, I have to cut you off. Unfortunately, I have to move on. We've reached the end of the program. You are cordially invited to come back onto the Newsmakers. I thank you very much for joining us, KK Shailaja.